Well, the second wave of COVID-19 is officially here whether we like it or not. And while avoidance is always the best prevention, we need somewhere where we can look to for reliable information and guidance. This is why the Centers for Disease Control and Prevention exist. Hi, my name is Matthew Semino, and let me tell you a little bit about the CDC. Through their rich history, their current experiences, and their future plans, this organization works around the clock to try and keep us safe. So let's get started. Founded on July 1st, 1946, the CDC was originally known as the Communicable Disease Center and was started by Joseph Walter Mountain. Their headquarters was stationed and still is to this day in Atlanta, Georgia. Some of their most notable early achievements include preventing malaria during World War II and the Korean War. They also, according to Thacker, Goodman, and Dicker, they established a revolutionary epidemic intelligence service, which is basically the foundation for modern-day epidemiology. Moving on to their present-day practices, a very important thing they do during the COVID-19 outbreak is compile data so that medicine and researchers in the industry can use this information to help combat the crisis. They also conduct COVID-19 testing, and they provide the resources to both large and small health departments so that they can conduct these tests for communities, both large and small. Another thing they do is, according to BBC News, they also offer public health guidelines to federal and state governments and citizens. So it doesn't matter who you are, the CDC wants to help you because we're all part of the community in the end, and we need to keep the public safe. The future of the company is looking just as good as the past and present. The CDC plans to continue conducting research on all types of public health threats, whether it be viruses, bioterrorism, really anything that can threaten the population. These prevention research centers, also known as PRCs, are a vital part in understanding any threats that the public could face. And according to Lewis et al. 2020, a recent study looked at how early virus spread in infected individuals spreads among vulnerable populations, which is a really important study in determining how COVID-19 spreads in the early stages of the virus, something that we didn't originally understand at all when it broke out in March. As part of the U.S. Department of Health and Human Services, the CDC are really the ones who fund all of this research, and they give new medicine through this program to its affiliates and to really anybody who's seeking grants, funding, and new opportunities that they otherwise would not have. So the CDC does truly hold up to their mission, I believe. They are committed 24/7 to giving the most relevant and accurate public health information to the public. They work around the clock, and they've always been passionate about what they do. This resonates very closely with me because I've always been passionate about health and personal well-being, and I think I would be a great addition to their team. It's always been one of the dreams of mine to find myself in the headquarters in that famous building in Atlanta, Georgia, working to promote campaigns, develop messages, and anything to promote public health and get it out to the people. Good things are on the way, and as the CDC and the FDA have worked very hard together, they will ensure that we have that vaccine in early 2021. Stay safe, everyone. Thank you.